Good afternoon, everybody. We're just going to give you an update on the program of ongoing improvements that we're implementing at managed isolation and quarantine facilities. Firstly, in regards to the testing of staff. Between the 21st and 27th of August, 97% of the total managed isolation and quarantine workforce were tested for COVID-19. No staff tested positive for COVID from that testing. The 3% of staff who were not tested were on leave or didn't enter a facility during the period under question. This shows the robust infection and prevention and control measures, including PPE, physical distancing and cleaning and hygiene within facilities, and daily health checks for all MIQ staff are working. On the 21st of August, Air Commodore Webb directed that all staff continued to be tested. The next round of testing of MIQ workers is currently underway as per the health order issued by the Director General and is due to be completed by Sunday the 6th of September. In regards to returnee testing, the figures we have are from the 18th of July to the 24th of August. These are the completed tests recorded by the Ministry of Health. They show that 97% of day 12 tests in MIQs were completed. The data shows that 95% of day 3 tests were completed. In that time, 11,647 day 3 tests were completed out of 12,240 returnees. Reasons why the day 3 tests might not have been done can range over a number of reasons. They could be that it was a child under 6 months, that they were medically exempt from taking the test, that they were a maritime or other transit passenger of between 24 and 72 hours and weren't in an MIQ for long enough to be there for a day 3 tests, or it could have been they were people that refused a test. Contrary to some recent reporting, this shows that very high levels of day 3 testing and compliance with the regime, noting that day 3 tests are not compulsory but are being done in high numbers nonetheless. We know day 3 tests are only part of the management of people in managed isolation facilities, and with or without the test, returnees are still managed in a way that considers that they may have COVID-19. No one leaves a managed isolation facility without a critical day 12 test unless approved by the Director General of Health as having a medical reason not to. Those people who refuse day 12 tests get the pleasure of staying at a managed isolation facility for a little while longer, and most of the time they eventually take the test before they reach day 28, which under the order they can be asked to stay with us for. I think last week we shared the data with you that to date there had been 15 people who had initially elected not to take a day 12 test. All of those people either decided that once informed that they were going to be staying with us a little bit longer to take the test, or eventually at some time in the lead up to the 28-day period did take the test. So I'll let Air Commodore Webb talk to you about the increased security arrangements that are currently being ramped up at the facilities. In terms of the COVID card trial that we'll be doing in the managed isolation and quarantine facilities, and this is work that is currently being scoped up and will apply to both returnees and staff. Thank you.
Thank you, Minister. Good afternoon, everybody. To date, over 44,000 people have successfully been through managed isolation and quarantine and have come safely into our community. Our effective capacity across 32 facilities is 6,628, and there are currently 5,035 people in managed isolation or quarantine. By the end of this week, we expect to have 5,638 people in isolation. We are continuing the rollout of the extra 500 New Zealand Defence Force personnel to our MIQ facilities. 108 are currently at their posts, and 75 will be rolled out each week for the next 5 weeks. There will be an average of 19 NZDF personnel at each facility, and this will be the largest use of NZDF personnel since our operations in East Timor. NZDF personnel have been given limited powers by the Director General of Health to give legal directions to people at our facilities and to approve or deny entry. People are legally required to comply with those directions. However, enforcement of those directions will, of course, be managed by the New Zealand Police. All of these personnel receive pre-deployment training that covers things such as supporting and acting with empathy, compassion in difficult circumstances, appropriate conduct and legal powers, the use of PPE, training in standard operating procedures, and COVID-specific health information to identify symptoms and, of course, take care of their own health and well-being. We have started the transition away from private security guards to guards employed directly by MB and are rolling out additional security technology. Lastly, I'd like to talk just briefly about exemptions. Exemptions, just again as a reminder, are granted in very limited circumstances. Our job is to keep COVID out of our communities, and we can't allow any undue health risk. Every single exemption request is assessed by a cross-functional team and looking at a case-by-case basis. The final decision is made either by me or by my colleague, Deputy Chief Executive for MIQ, Megan Main. Most exemptions are granted for people to join unaccompanied minors, people who are in transit, or people whose medical needs require hospital-level care. Exemptions can be issued for exceptional circumstances, for example, to visit a dying relative, and then only when the health risk is very low and we are assured it can be managed. When they are granted an exceptional release, in this instance, infection prevention and control measures and a self-isolation plan are still in place. Many of these exemptions will involve a day visit and then subsequently returning to managed isolation. Thank you, Minister.
Thank you. Happy to take any questions.
Quite a high number of cases that have been picked up in MIQs today. Is that because of ramped up testing?
No. Of course, our testing at MIQs has been consistent throughout. That everybody is tested, that the cases that we're seeing really is an indication of the fact that COVID is growing, not slowing around the world, and that we've had a couple of flights come in from places where we're seeing very high rates of growth of COVID, and this is to be expected when you're setting up managed isolation and quarantine facilities at the border. They're doing exactly the job that they were designed to do, and that is ensuring that people that enter New Zealand are tested and isolated for 14 days so that we can find out if they do have COVID and, if necessary, quarantine them.
The positive cases connected to that Air India flight. What can you tell us about the crew on board that flight? Have they entered New Zealand and are they being isolated?
Yeah, Air India flights routinely come through different places, including New Zealand, and their crew members are required to comply with Ministry of Health guidelines. Information we have, of course, that's not specific to MIQ, so it doesn't fall under our mandate, but what we do know is they do comply with the health guidelines. They have needs such as requiring to wear PPE, to self-isolate, to maintain physical separation requirements. So that's just an airline compliance requirement with health guidelines.
It's popped up in MIQ today in Wellington. Is that the first instance of one in Wellington? And how did that person get here, and what sort of contact tracing needs to be done, and how do you get them to a quarantine facility?
So the case in Wellington, I'll just start off. I understand that is a returnee from the United States, the Wellington case. I think it is the first case in a managed isolation facility in Wellington that we've had here. In terms of the contact tracing, that everybody is treated within a managed isolation facility as if they could have COVID. So in terms of the physical distancing, the PPE, all those kind of things. If there is a breach of that at the facility, that is picked up earlier. So nobody, by definition, within a managed isolation facility has a close contact other than the people that they're in a bubble with.
Because that obviously, so the United States flight would have come into Auckland, so how would that person have got to managed isolation in Wellington? What sort of contact tracing is that going to involve? And presumably you need to now get them back to Auckland to quarantine, right?
Yeah, so this was NZ1 flight from LAX, a routine flight. Many of you probably have caught that flight over the years. We have an internal domestic transfer system to manage the flow of New Zealanders right across the country, as I'm sure you'll be aware. So this individual would have been on one of those transit flights from Auckland to Wellington under the rules we have in place. Wellington has a dual facility, which is both an isolation and a quarantine facility. So they have a specific segregated area for people under quarantine conditions, which are a tighter regime than isolation, with additional hospital care and daily needs. Once the needs of that person has been met, they will then be taken to their final destination, whether that's Wellington or Auckland or anywhere else in New Zealand.
Is the facility the same in Christchurch as well? Because I thought that Jet Park was the only
Yes, so
quarantine.
Jet Park is, when you look at Auckland, you have 18 facilities. So as a ratio of volume and mass, we have a specific standalone quarantine facility in Auckland. When we're looking to try and use our locations as effectively and efficiently as possible, it doesn't make sense to have a standalone quarantine facility where we have a smaller number of locations per city. So in Christchurch and Wellington, we have arranged an assessment of each facility to see if they determine the criteria for both quarantine and isolation, and so that's what we do, and we have them in both Wellington and Christchurch.
Just further to that, there's an important safety element to this, that we do not want to be organising air bridges for known COVID positive patients, that it's much safer to put them into quarantine in the area where they already are. But just in terms of your first question, just to clarify, the person that transferred down, as all the passengers off that flight from LA wouldn't have come on a commercial Air New Zealand flight. They were charter flights that are air bridges between the arriving international flights and the managed isolation facilities. So there is no mingling with the general public.
Just on the air bridges, the press has a copy of a letter that was sent to you in June, apparently showing that more than 100 people who were in a managed isolation facility and were transferred to Christchurch, that occurred without information on whether they had been tested being present, and that health officials thought this was possibly dangerous, and that it happened in the middle of these returnees' isolation. Is that correct? And what was your response to that?
I'd have to go back and look at that particular piece of correspondence. I think I know the piece of correspondence you're referring to, but we'll get back to you. I'll have a look at it.
Sure with that at the time?
As I said, I'll have to have a look at the piece of correspondence. You're asking about a very specific thing. We'll come back to you.
I think I can recall.
Yeah, I can, I think.
Okay.
Yeah.
If you can recall.
Yeah.
Any more information you'd like to share?
Yeah, I was just going to say, we obviously looked hard at that scenario and determined that the best location to test somebody was at their final destination. That was following health guidance. So those people would fly, and it's the same system we use now. So they fly in to Auckland, they are facilitated under a level 4 environment onto a transfer charter aircraft down to their isolation location and are tested from that point on.
That correspondence is more just someone raised issue with this protocol, but you determined that that was the best protocol.
From memory, and I will come back to you with the specifics, that this was actually at a point of time when we initially took responsibility and accountability for running these facilities, where we were running into some capacity issues, and there were people from various timeframes and various cohorts that were transferred to managed capacity. That is not something that happens anymore. In terms of our ability to manage the flows ins and out, and to make sure that we're, by and large, trying to keep cohorts together when we provide air bridges. So that's an example of one of the things that has evolved over the 8 or 9 weeks since we took on this role.
Another matter, can I just clarify, when someone is in quarantine because they've been tested positive at either day 3 or 12, do they have to again be tested in order to successfully leave quarantine? Or if the term of period's up, can they just answer the health questionnaire and then leave?
So this is a health process from there on in when someone is in quarantine. So when someone has tested positive for COVID, there are then a range of, as with anyone, as if it were a community case, a range of indicators that health use to determine that nobody is still infectious. One of the things we do know about this virus, that it is possible to return a week positive quite some time after you've recovered and you are no longer infectious. So a negative test isn't the right tool to determine when it is that someone can be released. That's very much around symptoms and what we know about the virus and what the epidemiology tells us around when it is safe to release people. And that is a process that when someone goes into quarantine, that health then runs.
Wellington case returned a negative day 3.
I'm not sure if that was a negative day 3 or day 12. We'll have to get back to you on that.
So his day 12 is positive, but had he already done a day
We'll
with
have to
negative?
double check and let you know about that. Well, I mean, they would have, if they were still not in quarantine, if they were still in isolation, my assumption would be that they had returned a negative day 3. And we have had a couple of instances. This is why we have 14 days managed isolation, because that's what the epidemiology tells us, that sometimes that's the kind of time period that you need to take, particularly if someone were, for example, to contract the virus at an airport before they got on a plane. There's a variety of scenarios. But we'll come back to you whether or not they had completed their day 3 test.
Why not make day 3 tests mandatory? I mean, you have that public health response order where they have to test negative before leaving, and you have that low risk profile. Given day 3 is an extra layer of protection, why not make that mandatory?
So it's a really interesting question. I think what we're seeing is that we are having very high levels of day 3 testing. We can demonstrate that 95% of people have been undertaking day 3 tests. There'll be some reasons why a large number of those aren't, and I went through quite a list of those. So the actual low numbers that aren't doing it, we're still working through exactly what that might be. But I think one of the things to remember is that yes, day 3 testing is a tool, and it is an important internal tool for how we manage our managed isolation and quarantine facilities. But the most important tool that we have in our kit in running these facilities is to treat all returnees like they could have COVID. So that
day
is the
3
most
could be
important.
an extra layer of protection, so why not make that?
Yeah, look, and I mean, look, as we've shown, we're willing to evolve and we're willing to look at change, and if that is something that is deemed necessary, then that is certainly something that we will pick up with our colleagues in health. But I think one of the things that the public have to have some certainty about is that we have not seen either a community case of COVID linked to a managed isolation facility, but importantly, we have not seen community transmission within our managed isolation and quarantine facilities either. We have not had an outbreak. The day 3 test would become even more important if we were seeing that. I think what we're seeing is the success of the system that we are running.
The source of the infection in terms of the Auckland cluster, that's still a mystery, so you can't say with a strong degree of confidence that there is no link to managed isolation.
What I can say is there is yet to be a link established, and I can say that with absolute confidence because there has not been, we have not had a link that shows any conclusive link to a managed isolation facility for the Auckland cluster, and actually the genomics would point us in the direction that it is highly unlikely, because that is something that we've been chasing down really hard in terms of not only the strain but also the generations of the strain.
The occupancy level.
Sorry, thank you.
In terms of the occupancy level, the latest data we have is that there's 5,018 rooms that are full. There's 2,348 that are empty. There's another 600 being cleaned right now. So about 1/3 of the MIQ system is currently empty. There's no one in those rooms. Why are they empty, and are you doing something to fill them?
It's important that we maintain sufficient capacity at any given time. So 10% remains a contingency surge requirement. What we have experienced so far is actually continuing reasonable levels of volatility in international travel. The last thing we'd want to have is a situation where we had arriving aircraft which were full beyond what the plan was, and then have an inability to manage it. So what we've learned over the last probably 8 to 10 weeks is a need just to be quite cautious and be conservative in our approach to those numbers. We take a look at those all the time, and I tend to agree to say that we need to continue to identify mechanisms to lift those. We are engaging every single day with a range of airlines to work their alignment between supply and demand, and we are, you'll see as the data shows, actually those numbers are climbing in the next period. It's a 14-day cycle of activity, of course, so you can't just suddenly flick a switch and expect it to climb overnight.
In 14 days, though, you're only looking at 5,300, so that's only like another 200 or so rooms. It'd still be around at 30% empty. So are the airlines not selling enough tickets, or is it because of the quarantine here? Or do you have any understanding why people aren't coming?
Yeah, I think there's a range of measures. What we are seeing, certainly flights into Australia, they've put a number of conditions and constraints on the international air travel and domestic air travel in Australia. We know Australia makes up the vast majority of the arrivals to New Zealand, something like 80%. So when we're seeing higher volatility, less certainty of travel in Australia, consequently, we're seeing less movement to New Zealand.
But sort of further to that, so you were looking to implement a golden ticket type system. Where is the hold up with that, and especially with Air New Zealand as well?
So there is no hold up. That work is progressing well. That's the managed isolation allocation system, and we're well on the way to having that being rolled out. We're expecting that in the coming weeks. We need to make sure that it's a robust system so that we know that when someone is booking both a place in a managed isolation system, that they've also got the opportunity to match that with being able to get an air ticket, and that they can complete the two things in parallel. Because one of the things that we do need to know is when those people are coming. But I don't know if you want to add any more to that.
No, that's fine.
3 weeks, I think it's been roughly 3 weeks since the government started charging returnees for managed isolation. Do you have an update on how many people have actually been charged?
We can get that to you. I know that data does exist, how many invoices that we have, but I think it's worth noting on that we have also been running the exemption system around that as well, which is separate from the exemptions that Darren was talking about earlier for people who find themselves in a position where they are unable to pay. But we can get you an update on that.
How long before you consider building standalone or specifically designed quarantine facilities to expand the size of quarantine, which seems to limit the number of people who can come in and out of New Zealand?
So I think they're two separate questions that you just asked me there, whether it's about building purpose-built facilities. That is, of course, something that we have, that has been in our thinking from the beginning. That part of our task is not only to manage the immediate and what we're going through now, but to think about what this might look like in a more semi-permanent state if we are needing to do this for another year or another 18 months. So we are not opposed to looking at purpose-built facilities. What we need to do is have a look at how that stacks up in terms of the cost of construction and the cost of running it compared to what we're doing, which is essentially leasing hotels at the moment because we've got 100% occupancy. But the constraint on managed isolation is not facilities. So to talk about doing that is a pathway to expand capacity, I think, is the wrong way of thinking about it. The constraint around managed isolation facilities is really around our health capacity and our ability to do this safely. So it takes an enormous amount of health resource to go into each and every one of these managed isolation facilities. And every member of our health workforce that we put into these facilities, we're taking, of course, from somewhere else in our health system. So we need to think really carefully about what the right balance is in terms of the ability of New Zealanders to return home, how we might want to open our border in the future, also with the need to have a functioning health system in New Zealand.
So where are we at in the process of deciding, yes, we need dedicated facilities or not?
It's policy work that we're continuing to explore.
Have you
Genomic
taken
testing.
any consideration of the social living style of Māori and Pacific Islanders, and how is that reflected in the facilities?
So in terms of the way in which the facilities are run, they're run very much according to bubbles. And that there is a requirement for people to stay within those bubbles. It can differ slightly between quarantine and isolation facilities, but these are hotels, and they do have the limitations that they are largely single rooms or sometimes a family room of a couple of rooms. But what we try and do for families, and particularly large families, and many of our Māori and Pacifica returnees fit into this, is to make sure that we have adjoining rooms. But the most important thing is that only those people that should be mixing with each other and should be within each other's bubbles are able to mingle. That we recognise that this is difficult for people, but this is the way in which we ensure that we don't have COVID getting out into our community. So while we try and accommodate that, we also have to make sure that it is only people within bubbles that are mingling.
On the genomic testing, how much has been done over the last couple of weeks of people who have tested positive and come through managed isolation or quarantine facilities in terms of linking it back to that Auckland cluster? Have you tested everyone that you can to check whether there is a genomic link?
So I'll leave health to give you the absolute numbers on that, but I can speak in broad principles around that. Yes, this was one of the first pieces of work that we did. We did it, first of all, looking at knowing what strain that the community cluster was, which is the B111 strain, and knowing where that is most prevalent in the world. And we know that that is most likely to come out of the UK. So the first thing that we did was go and have a look at all our positive cases that had returned from the UK in that period and made sure that we had done sequencing on those. And if we hadn't, could go back to those samples and do genomic sequencing on them as well. None really fitted with the timeframes when we think that the most likely first entry point would have been to fit with that community cluster. But we have gone back and done testing where we didn't have it on a number of our positive returnee samples. Not every sample is possible to do the sequencing from. While you need a relatively small amount of viral load to be able to run a test to see if someone's COVID positive or COVID negative, you do need a large amount of DNA to be able to do the sequencing. So not each and every sample has been able to be completed, but where they have been, we've certainly been going back, and ESR have been doing a wonderful job in doing that, and then looking at what the lineage, so the lineage of all of those sequences are and how they might fit together.
Based on the genomic sequencing, are you saying that it's quite unlikely this came from MIQ facilities?
That's the advice that we're having, yes.
Is the working theory still that the Ridges maintenance worker was infected in the lift?
That seems the most likely.
So that's sort of that case concluded.
Yeah, that
was how that infection happened.
I think from health's perspective, that case is closed. In terms of that seems to be the most likely scenario in terms of how that case was contracted. And there have not been any other cases of that strain, the B1 strain, that have popped up in Auckland. So that we're not seeing that in the community cluster. The community cluster is all the B111 strain. So all of the known contacts of the maintenance man have been tested, and all of the staff at the Ridges Hotel. And there have been no further positive tests.
And what have you learned from that, and what procedures have changed from that now?
Do you want to talk about your directive? Yeah.
I think what we've learned is well, first of all, we've heard a lot is COVID is an evolving knowledge base about how to deal with it effectively. There's no silver bullet or single approach. I think it's a layer, and you've heard us talk about the different defence layers over time about how to try and deal with it. You know, can I just acknowledge the tremendous work in each facility by both the hotel staff and also every single worker that's on there, you know, putting their hard work in, day out. And so it's a range of infection prevention control measures is the first line, making sure we are using the right hygiene systems, face masks, cleaning protocols. We're always investigating different technologies, and you've heard the Minister talk about some of the cleaning systems that we use. They are hospital-grade cleaning devices. And every single time we discover something like a lift as a potential vector, again, we're taking immediate steps to change our systems to increase the cleaning protocols to make it as safe as it possibly can be.
But on the, sorry, just on that, I think it was the 21st of August that you did issue a directive to the operational leads in the managed isolation and quarantine facilities, just while we work with health about what the right health approach might be, about what expectations are from a facilities point of view in terms of use of sanitiser and how that's to be placed within the facilities.
Are you saying that you've asked for a more regular cleaning of lifts, for example?
So lifts, essentially it was let's make sure that hand sanitiser as an absolute key requirement is available and used every time someone goes in the lift.
Is a standard operating procedure being implemented yet in all of these facilities that details things like how often things should be cleaned?
Yes, that's right.
Yes. But I just, in terms of the lift as the likely vector for the Ridges maintenance worker, I think it's worth remembering that there was a 2-minute interlude between the returnee riding in the lift and the maintenance worker riding in the lift. I don't think there's a standard operating procedure with a cleaning regime that will be every 2 minutes. So that's why we have to layer in other processes like the use of hand sanitiser.
Just back on the numbers that you were quoting at the start, how many days 12 tests were done over that period?
The day 12 tests that were done over that period were 9,871. We can share those with you if you'd like them.
Sorry.
Sam Morgan has confirmed that his group is pulling out a COVID card. What does that mean for the trial that was supposed to be happening in Rotorua this month?
Well, there's actually two different trials. So there's the community trial in Rotorua that Minister Whāpoi is in charge of in terms of how it might be used from a community level. Then there's also the trial that we announced that we're going to use within a managed isolation and quarantine facility with both staff and returnees. And we had a conversation with the team this morning around and have a further meeting lined up this week about what impacts that could have on the rollout of our trial, and the answer is absolutely none. We're still in a position to keep working through that, and we're still working through where that trial will be. We have a couple of contenders of isolation facilities where it will be useful as a tool to be able to track contacts within a facility, but that's quite separate from the Rotorua trial.
What's your understanding of how, what was the reason between the government and this group parting ways? What's your understanding?
Look, that's a question that you'll need to put to Minister Whāpoi. Yeah, we haven't been working with Sam Morgan. We've been working with the all of government team that have picked up a lot of that work. But I know you've been quite connected to that. If you have anything to add, okay, yeah.
And MIQ going to start?
I think it should be within 3 to 4 weeks, is my understanding. But certainly, once we get the feedback on the range of questions that we've put to the team, and then we'll be able to look to get away with it smartly.
So we're thinking about more creative ways that we can use it. So, for example, that a COVID card works by person-to-person contact. What we'd be interested in is how could we utilise this technology so we'd know who was in a given lift. So is it that we can actually place COVID cards in particular hot points within our facilities and then see what interactions returnees have with those. So we're thinking about how we can use the technology in a slightly different way. So that's what we're just working through with the team at the moment.
Yes, do you have any update on when the regular testing of MIQ workers will start?
Well, that will be with the health order that comes into place. But one of the things also, the 21st of August, I think, was a day of directives that you also, Darren also issued a directive that even before we got into the mandatory testing regime, that we were going to start a rollout of regular testing of our staff so that we could identify where there were any kind of potholes in order being able to get high numbers of tests completed, and we've completed, it's 95% of staff, I think, in this next phase, so we've got good uptake there.
From an MIQ facility, what are the most likely?
Sorry, we'll just go here, thank you.
If not from an MIQ facility, what are the most likely outcomes for how this Auckland cluster came about?
Look, I think that is something that we're continuing to try and hunt down. No one wants to know more than we do about how it is this current cluster started, because once we know how this one started, we can prevent future clusters in the future.
Run down all the leads though, and you just have to accept that we may never know.
Oh, look, that could be the case, but it doesn't stop us continuing to use all of the tools in our toolbox to both stamp it out and trace this virus. It is a tricky virus, we know that, but if we are to succeed in stamping it out, we need to be vigilant in following every lead.
Sea border been a blind spot?
Sorry?
Has our sea border been a blind spot?
Look, there is no link there to the border. I think what we see is that there is no playbook for this, and that as a government we have to be prepared to continually evolve and improve as we go through. I can speak to the managed isolation and quarantine facilities, what we're here to answer questions about today.
If our air border is so tight and managed by you guys, then the other obvious would be a sea border, right?
Well, I mean that remains to be seen, and why we continue to hunt it down. Sorry, I think
how many healthcare workers? Okay. How many healthcare workers are required at each managed isolation facility?
We have the data. I can clarify it for you, but I think it's in the order of 5 or 6 per facility.
Okay. And just in terms of scaling up, no doubt takes a while to get all these systems in place, and as you get better at managing these facilities, how much scope do you see to actually expand that if the healthcare workers require only sort of a handful at each facility? To expand facilities? Yeah.
So I think you've heard the Minister talk before. It's not just about the frontline healthcare workers. One of the things that's become clear to us is we need to always be thinking about what if the worst happens and we have a significant number who need follow-up secondary or tertiary care. So when we're looking at that, it's not, as I say, it's not just about those who are doing samples, doing testing, administration of medical facilities. It's actually also about the follow-up care. And so both of those things go hand in hand, and which leads us to a current capacity which we feel is pretty close to where we are right now.
And I think Queenstown is a really good example of that. Fantastic facilities, lots of hotels, but a hospital with 40 beds or so, a handful of beds in it. But also, so if the worst happened and you did have an outbreak in one of the hotels, there would have had to have been transport to Dunedin for secondary or tertiary care. But one of the other things that has been absolutely pressed on us by the DHBs is the high mental health needs of a number of the returnees, the people that we're getting coming home now, who are coming from some pretty difficult circumstances. So from a public health perspective, we also have to ensure that we have capacity within that DHB to manage the well-being in a broad sense. So it's not just taking the number of frontline health staff, as Darren said, and timesing that by the number of facilities you'd like to see. It's a much more sophisticated view of the health system.
You're saying that's it? You can't do any more than 300-400 people a day and that's it?
Look, we are saying that actually our capacity is around 7,000 people per fortnight, 14,000 people per month. That is actually a large number of people. Are we saying that is that it forever? That is something that we need to continue to look at. But one of the things that we are saying at the moment, safely, what we can do without putting too much pressure on other parts of our health system and taking away from other things that we need to do, that this is about right and getting the balance about right.
14,000 a month.
14,000 a month.
Why are you issuing paper invoices for quarantine costs? Why don't you have a way to pay in advance?
So, look, that's quite an operational detail that even I don't get into the form of the invoice, no matter how much people might think I micromanage. That one of the pieces of advice that we did get when we were setting it up, though, was actually not to have a requirement for people to pay in advance to actually be able to post-issue the invoices. The ability for people to enter their country can't be precluded. We didn't want to make payment up front the only way you could come back, because we do have to have a way to manage the exemption system as well. So that is one of the reasons. But I can get you the method of invoice detail if you'd like.
Yeah. On those testing numbers, so there was 11,647 day 3s, 9,871 day 12s, and those were the tests completed between July 18 and August 24.
Yes.
That doesn't match with your public reporting on it. It's only 18,304 reported daily updated tests, whereas this equals 21,808.
Yeah, and like we have gone back and had a look at and sorts to some more data around that. Some of it was actually around the days in which this is test results that are recorded and reported back. So there is a difference between swabs taken, tests sent to the lab, and then tests reported back. This is the reported back data. So there were some days, if they weren't reported back on a given day, they might not have been captured in the data. It wasn't caught up with in the data. So we've gone back and done a further interrogation of all of that and done some reconciliations. But look, we're happy to give you.
The tests have
We're
definitely
happy to
been
give
done.
you the numbers.
The medium to longer term, could you just talk us through what your thinking has been, perhaps in terms of looking at other solutions for longer term tourists and students, and whether you are at all looking at perhaps getting them to test before they come and looking at different facilities if they don't need perhaps as much mental health support, for example, because they're coming on holiday. Have you been looking at some of those other options? I mean, I know there's been a lot of talk about the usefulness of testing before someone leaves, and it might not be that useful, but it could be a layer of defence, for example.
Yeah, so I think there's several questions in there. Are we as a government looking to the future and how we may in the future further open up the border? Of course we are. I think this is probably one of the biggest questions that is going to come over the coming months, and how it is that we do prioritisation within that, and who it is that we first allow in. So we are continuing across a range of ministers to do that policy work, and it is an important piece of our work programme program as a government at the moment. In terms of the ability to have more facilities by using other measures like testing before you come, as you've identified yourself, that's of limited use. That one of the things that we know, if you have someone who, for example, has to have a test 72 hours prior to departure, we have no assurance over what they do in that 72-hour period, what happens at the airport, what happens on the plane. And actually what we know at the moment is international air travel is a particularly risky enterprise, that you're mingling with people from a range of places that are transiting from all different parts of the world. Particularly as New Zealanders coming home from the riskiest parts of the world won't be taking direct flights. They'll be transiting and getting onto planes with people that are coming from a range of countries. So of very limited use, pre-departure testing to New Zealand. So in terms of the compliance around it, making sure we had the right assurance, in terms of the point of departure, who verified labs were, I think I'm not convinced myself of the worth of it, and I would much prefer that we had a robust system this side of the border with 14 days managed isolation, with day 3 and day 12 testing, and no one being released, importantly, without that negative day 12 test. And what we are seeing is even people with negative day 3 tests, after they arrive in New Zealand, with positive day 12 tests, as we talked about earlier in this stand-up. So that's the most important. In terms of other facilities in the future, that's all work that will continue.
Christchurch MP local MP hat on. I was just wondering your thoughts on the Green School getting $11.7 million in funding, given the likes of Redcliffe's had to fight so hard to get their school rebuilt.
I think I'll take the second part of your question there, in terms of the rebuild of Redcliffe schools. That was something as the Minister of Greater Christchurch Regeneration that I was very happy to be able to progress very early in our term of government to make sure that we got the sites sorted out for that school could go.
Right.
We were very happy to get the sites sorted out for that school, to know that that community that was really shattered by the loss of its school could get a rebuilt school. But I think there's many other ministers you can ask questions about the Green School too.
Is to give them funding when
on
this
that
Green
topic, with your campaign chair hat on then, what do you make of Glenn Bennett, the Labour New Plymouth candidate, doing a complete 180 in the space of 4 days, going from saying, yeehaw, we've got the money for the school, to let's protest against it?
Look, I think that we are engaged in a democratic process and there will be a range of views. I completely agree with what Minister Hipkins said yesterday. And just to further to your point, it didn't take 10 years for Redcliffe's to get the money out of our government. Okay, thank you very much.